I'm Bridget Gray, and I'm going to talk about African sleeping sickness, tsetse flies, and parasites. So a quick overview of what we're really going to go in depth in is parasitology, African sleeping sickness, tsetse flies, Trypanosoma brucei, disease transmission, the parasite life cycle, recent study, and the diagnosis and treatment of African sleeping sickness. Parasitology is the study of parasites. It typically analyzes three different categories of parasites, including parasitic protozoa, parasitic helminthines, which are worms, and certain arthropods, which feed on hosts. Parasites are organisms that directly cause disease or act as vectors of various pathogens, and this comes from Medical Parasitology, which is a textbook. Parasitology also looks at what parasites do and how it affects their hosts. African sleeping sickness is most commonly found in Africa. However, it can occasionally be found outside of Africa. However, the victim has usually recently been in Africa and were infected in Africa, but they did not start showing symptoms until they returned home. And African sleeping sickness is caused by a parasitic infection by the Trypanosoma brucei. African sleeping sickness infected an estimated of 30,000 people in 1995, but the number has since dropped to around 15,000 people in 2014 due to there being control activities being done to help reduce the amount of people being infected. There are two main stages that occur in this disease. Some common symptoms in stage 1 include sleep problems, fever, joint pain, irritability, weight loss, and a thing called chancre, which is a sore caused by the bite of the tsetse fly. And stage 1 usually occurs outside of the central nervous system and can be found in the blood and the lymphatic systems along with certain organs such as the heart, liver, spleen, and the eyes. Common stage 2 symptoms include confusion, seizures, headaches, numbness, coma, unconsciousness, and personality changes. And stage 2 typically invades the nervous system such as the spinal fluid and the brain. And African sleeping sickness is contracted from the tsetse fly, and it can be treated if it's caught before neurological involvement has occurred. The tsetse fly is the primary vector of African sleeping sickness and can cause other diseases, such as the nagna, which is similar to African sleeping sickness but more commonly affects animals. These flies are very large in size and are only found in Africa, and they are parasites as they live off of the blood of mammals, and the infected flies can transmit disease whether they're male or female. They are not sex biased, and the flies become infected themselves by biting already infected individuals. Trypanosoma brucei. There are two types of Trypanosoma brucei that cause African sleeping sickness, the Gambensi and the Rodensi. Gambensi is more common and often affects humans. The Gambensi causes about 97% of cases, and it's found in Central and West Africa. The infection is typically slow, and it can take months to years to manifest, and it causes the more chronic symptoms. And the Rodensi is less common and more commonly affects animals rather than humans. However, it does still affect humans. And it causes only around 3% of cases, and it's found in Eastern and Southern Africa, and the infection happens very fast. It usually occurs and shows and manifests within a few weeks, and it shows more acute symptoms, and both of these are carried by the common vector known as the tsetse fly. Disease transmission. Disease is most commonly transmitted from the bite of the infected tsetse fly. The tsetse fly becomes infected by biting an already infected individual, and transmission can be also caused by sexual activities, mother to child, blood transfusions, and the sharing of needles. However, this is more uncommon And the transmission from mother to child occurs by the parasite already being within the mother, and it passes through the placenta, through the bloodstream, while the baby is still inside of her womb. The parasite life cycle typically takes around 3 weeks, and after transmission occurs, the Trypanosoma brucei begins to infect the host's body by entering through the skin and into the bloodstream. When the Trypanosoma brucei enter the human body, they are in an infective stage of their life cycle known as the metacyclic trypanomastogote and continue growth by binary fission, and this information comes straight from the CDC. Once they reach the bloodstream, they grow into slender trypanomastogotes, and they begin to multiply rapidly in the bloodstream and in the lymph nodes and in the spinal fluid, and they do take on 3 different forms. The 3 forms are long and slender, short and stumpy, and the intermediate stage. The short stumpy form is pre-adapted for survival in the tsetse fly, so it is the form that differentiates into the next stage of the life cycle when the fly takes a blood meal from the infected mammalian host, and this information came from your genome. Once inside the tsetse fly, the trypanomastogotes will travel into the gut and begin transformation into the procyclic trypanomastogotes, and they will multiply rapidly. Then the procyclic trypanomastogotes will travel towards the salivatory glands of the tsetse fly, and during this process of traveling there, the procyclic trypanomastogotes will transform into epimastogotes, and the epimastogotes will eventually reach the salivatory glands, and when they get there, they will attach to the walls of the salivatory glands with their long flagella, and the epimastogotes will sit there and hold on until they turn back into the infective stage, which can affect mammals. And once they reach that stage, they will detach from the walls, and they will wait to be transmitted back into a new mammalian host by the bite of the tsetse fly. A recent study found that the Trypanosoma brucei is a very smart parasite, and it can stunt its growth until it's transmitted into the next organism. And this is because if it's in the wrong stage within its host, the host's immune system will actually pick up that it's existing within it and attack it and kill it off. And I found this really interesting quote that I just really liked about it. One of the key things that happens is that as the parasite is floating around the mammalian blood, it perceives its neighbors and says, "Oh, there are a lot of us," and becomes a different form that is ready to go into a fly. If the fly were to happen to bite that person, that form that's ready for life in the fly, that doesn't grow, it's not a growing form, it's really sitting there waiting to be taken up by the fly. Once it passes into the fly, though, it begins to grow again, and it becomes a form that can live in the fly. And this came from a personnel worker and a faculty member at Clemson University. Diagnosis and treatment of African sleeping sickness varies differently by the stage of the disease you're in and which specific species is infecting you. First stage diagnosis is most commonly diagnosed by looking at blood underneath a microscope. However, this really only works well for the Rhodesies, and it's really not very helpful when looking for the Gambenses. However, the Gambense strain is more commonly diagnosed by looking at lymph node fluid, as they commonly live in that more than the blood. The second stage is more commonly diagnosed by analysis of cerebral spinal fluid, as during the second stage, like going into the nervous system. And the second stage is much harder to treat, as the medication becomes more toxic and it's harder to administer. And the treatment does depend on the type of parasite and the stage of the disease, and there are currently no vaccines. And these are my references. Thank you.